the things which prostate can do and how you can take care of it. So I think prostate is a normal organ present in all the male human beings, and it causes problem mostly after the age of 50. And after 50 years, most of the adult persons, more than 50 aged ones, they start having this slight enlargement of the gland. Now, enlargement of the gland means the gland increases in size and it causes problems with your urinary flow. So the most common symptom is the outflow obstruction. But that is just one part of the symptom. There can be other things, like you can have urgency, which is increased desire to go urine as soon as you feel like. You can have urge leak. You can have nocturia. You can get up in the night more than 5, 6, 7 times to void. You can always feel that your bladder is not emptying properly. You can feel every 5-10 minutes you feel like passing urine. So all these symptom complexes, what we call as lower urinary tract symptoms. And there is a scoring system available, which you can, if you go to any Lutz clinic or any urologist, they will give you a scoring system where you can score it. So that will give you how serious your problem is. Once you identify the problem, another thing is, once you identify your problem, you have to start treatment. Now the treatment comes, the major part of the treatment is mostly nowadays pharmacological. Before 90s, maybe mid 80s onwards, the mainstay of treatment was surgery. But now there are good drugs available in form of tamsulosin, silodosin, which gives good benefit to patients and save them from having surgery. So once you have these problems, you must visit your urologist. You get a uroflowmetry test where you measure your urine flow rate, and then you get your basic tests done, like to rule out any diabetes and other comorbidities which you can have at this age. Followed by that, you are put to probably a general examination, a digital rectal examination, which can give you a prostate, the basic assessment of the size of the gland. Now, once it comes to medical management of part of it, you have to, when you are very old, you have to cut down on your fluid intake. You should restrict your fluid intake to around 2 to 2.5 liters per day. You should restrict fluid intakes after 6 p.m. Avoid having a lot of tea, coffee, alcohol, things containing caffeine, which can actually make your bladder more active. The other most important part of lifestyle modification is to avoid constipation. Now, once you have a constipated or a hard stool, you tend to have more of these urinary symptoms. And once you have a flow rate which is less than 15 ml per second, your doctor will offer you some medication depending on your age. Now, the best medication available is tamsulosin. Once you start yourself on Tamlin, your flow rate increases, you cut down your fluid, you take some fibers, your bowel movements improve. So slowly you start coming in terms. So prostate is nothing to worry. Nowadays, more than 70 to 80% cases, they don't require any surgery, and there are good medical management available. Around 20 to 30% of cases, they still need surgery. And when you don't have respite from the medical management, you undergo treatment. So today, is there anybody else who wants to ask questions? I'm seeing people are going through them. Bring them on camera. Okay, anybody else who wants to ask any question can go ahead and ask me any questions. So this is Mr. Poonam Shekhar asking, can BPH happen in younger class of patients? Generally, BPH, it's not BPH, it's not benign prostate hyperplasia. But yeah, prostate problems can happen in younger age group, what we call as primary bladder neck obstruction. That basically less of a bladder, but more of a bladder neck problem. Now, the prostate and the bladder neck are quite synchronous terms. They are quite connected to each other, very close to each other. So, but just by looking at ultrasound, most of the time when I sit in OPD, I have patients who come with the ultrasound saying my prostate is 25 grams, 35 grams, his age is hardly 25 years. So one thing I can tell you, ultrasound abdomen is not a good test to assess the size of the prostate. It's around gives 50% estimate of the size. So if you have a truss which is transrectal ultrasound, that gives a better size assessment, and especially younger population less than 50 years of age, you need not worry about your prostate unless and until you have something called prostatic abscess, which can happen in most younger population where you're sexually active, or even if not sexually active, you can have bouts of fever, severe pain, dysuria, a tender prostate on examination. That can lead to a prostate abscess. So abscess is something which is there in the younger population, but benign prostate hyperplasia or enlargement of prostate per se is not a disease of younger population. It's a disease of population more than 50 years, 60 years of age. No, BPH cannot happen at 40 years. Yes, BPH and OAB can have synchronous. BPH and OAB can be synchronous. They can happen together. Lots of patients with BPH can have overactive bladder symptoms. Long-standing bladder obstruction due to prostate causes changes in the bladder mucosa that leads to overactive bladder symptoms. Things like you feel urgency, small frequent voids, urgent leak. So all you need to do is once you remove the obstruction, that means either by taking tamsulosin or by operation, you need to cut down on the fluid intake, you need to monitor your bowel, you need to cut down on caffeine and things like tea and alcohol intake. So all those things will help you in managing OAB symptoms along with BPH, but they can simultaneously occur and it's a very difficult thing to treat and diagnose. If BPH is left untreated, the natural course of the disease, as we say, is two stage. First is BPH left untreated can cause acute urinary retention, and the second is you either get surgically treated before causing acute urinary retention. Those are the two end points. But even if you get a obstruction and you don't get yourself treated or diverted, then long-standing obstruction can cause retention of urine, and that retention can cause back pressure changes to your kidney. You can have obstructive uropathy and nephropathy, and sometimes it can cause irreversible damage to your kidneys. Now, BPH does not lead to prostate cancer. Prostate cancer and BPH are totally two different diseases, and they have no per se any connection. So BPH never leads to prostate cancer. Rani Kumari wants to know that can BPH lead to prostate cancer? No, prostate cancer is a totally different disease and it's a different thing. BPH does not lead to prostate cancer. Prostate cancer is sometimes familial. Around 5 to 10% of the cases are familial. Most of them are sporadic cases, and it has a total different etiology. It has nothing to do with the benign prostatic hyperplasia. Now, somebody is asking about the types of surgeries. There are a lot of surgeries available nowadays. The gold standard treatment for surgical treatment for benign prostatic hyperplasia is monopolar TURP. Nowadays, bipolar TURP are available for older age group and people with heart problems. Now there are a lot of laser procedures available where you get enucleation of the prostate gland or evaporation of the prostate gland, green light evaporation. There are multiple options available nowadays, but I still feel the gold standard is transurethral resection of prostate using a cautery machine, which is mostly monopolar. Some people who have things like pacemaker, long-standing heart diseases, fluid overload problems, they can undergo bipolar resection. But monopolar resection is the still most commonly performed procedure, and surgical intervention can be managed. Now, robotic surgeries have nothing to do with transurethral resection of prostate. Robotic surgeries have everything to do with the prostate cancer treatment. So, robotic treatment has no role in benign prostatic hyperplasia management. Things are going more endoscopically, and there are other things available, something called lift, where Urolift, where patient is very debilitated, long-standing obstruction, you can't operate on the patient because of high surgery. So there are procedures available for that also. And prostate 35C, does it require surgical intervention? See, again I said again, let me re-emphasize the fact that the size of the gland has nothing to do with the type of intervention needed. Some people can have a 50-gram gland and just be as good as anybody else without requiring any treatment. And some people with a 25-gram can require treatment. So, Mr. Kishore, I can tell you that prostate with 35 cc on ultrasound has nothing to do with the treatment. It all depends on symptoms, how is your urinary flow, what you are feeling, and depending on that, only treatment can be picked up for you. It's a very specific kind of treatment, which is patient specific and symptom specific. It has nothing to do with the gland size. Gland size most probably plays no role in the symptomatology and treatment. Maybe later on when you decide to have a kind of surgery or what problems you're having, that time you may decide the gland size. But just because somebody you say is prostate is 35 cc and he's avoiding quite well, he doesn't have any flow problem, he doesn't require any treatment. So Mr. Kishore, prostate of 35 cc, does it require surgical intervention or can be medical management, is totally dependent on the symptoms of the patient. It depends on how patient is avoiding, how his uroflow is, what are his other symptoms, and if he has any relief with the treatment or not. Now, the symptoms of prostatitis are increased micturition, painful micturition, fever with chills, and feeling of incomplete bladder evacuation with perineal pain. So all those things which comes, fever of unknown origin, not settling for a long time, recurrent fever, fever with chills, having dysuria, means pain while passing urine, all those things are symptoms of prostatitis. BPH and OAB are linked. Yeah, sometimes what happens is long-standing BPH causes long-standing obstruction, and that can lead to changes in the bladder mucosa, and that can cause overactive bladder symptoms. So overactive bladder symptoms can sometimes affect patients with long-standing BPH, and that's all. Anybody else? Any other questions? I hope I answered your question, Ms. Poonam. So, Mr. Kishore, I think I answered your question. So, 35 cc gland, don't go by size of the gland. Okay, don't believe the ultrasound which is served to you, because most of the time these ultrasounds, they give a false sense of either sense of feeling bad or sense of feeling good, because what it sees is around 50% of times a rough estimate. Unless and until you have a transrectal ultrasound. The other most important thing to look on an ultrasound, which most of the good ultrasound people, good ultrasoundologists report, is a post-void residual urine. Now, the whole point of having a good urinary flow is to empty your bladder. Once your bladder empties well, there is no stagnation of urine, and that doesn't cause, that takes care of a lot of problems like urinary tract infection, long-standing diabetic, obstructive uropathy and things like that. So if your PVRU, you look at your ultrasound report, and if you have PVRU, post-void residual urine, which is quite less, maybe less than 10%, that means if you have 200 ml of urine, you end up with 20 ml of urine post-void. That means you are quite doing fine, you don't need any intervention. Now, some people have things like pre-void volume of 400 ml, and after void they have 200 ml left in the bladder. That is a thing of concern. That must be handled first by fluid restriction, by double voiding. We have to look at the changes in the bladder, and then we have to think. So somebody is asking, Chandan, what are the complications of prostatectomy? Now, the complications of prostatectomy can be from very minimal intraoperative hemorrhage, post-operative hemorrhage, infection, long-standing complication like stricture formation. Many more complications can happen. I have seen general surgeons operate and make a rectourethral fistula. You can have bladder perforations. You can have massive bleed intraoperatively. Post-operatively, most of the time infection, sepsis, and long-standing means maybe 3 months, 6 months, or a year later, you can develop a stricture in the urethra. So those are the things which can be complications. And what type of lifestyle change one needs to adopt to make the treatment more effective. So lifestyle changes are most important point in treatment of lower urinary tract symptoms due to benign prostatic hyperplasia. The most important point is to reduce the fluid intake. Some people are prone to drink more. They are called avid water drinkers. They drink more fluid. But what we need to do is to restrict the fluid. We have to cut down the fluid to require amount of around 1.5 to 2 liters per day. Reduce fluid intake after 6 p.m. in the night. Most of the time, these elderly people, they end up drinking a lot of water in the evening, and then they start going to bed in the bathroom in the night. They are more prone to have falls in the night. When they get up from middle of the sleep to void, they can fall. So we must ask them to avoid drinking a lot of water in the evening. We must look at the bowel of each patient. We must monitor how their stools are, whether they are passing hard stool, or their stools are soft, are they constipated. Some patients, they come that they haven't passed stool for 5 to 6 days. So all these things are part, and they should take a lot of fiber in their diet. So those are the important lifestyle changes. Losing weight also helps in getting good perineal exercises, and all those things can help. So, but I'll stick to the fact that restricting fluid, avoiding a lot of alcohol, caffeine, cigarette, and taking care of bowel, avoiding constipation will help a long way in your management of BPH. Any other questions? Anybody wants to ask any further questions, or I'll like to close at this point. Thank you very much, everybody. Yeah, I said post-operative complications. I told you it's bleeding, hemorrhage, infection, all those things. Yes, long-standing BPH can, and most of the time BPH leads to UTI infection. Recurrent urinary tract infection is one of the indications for surgery in case of BPH. If patient with BPH on medical management tends to have a lot of stagnation of urine and keeps on having recurrent urinary tract infection. Now, how BPH leads? BPH causes a stagnation of urine, and any stagnant urine which is not passing, can lead to urinary tract infection. So yes, BPH leads to UTI, so you must treat BPH to avoid recurrent.